My name is Tegan. I'm a pelvic floor physiotherapist, and pelvic floor muscles are some of the most important muscles we have during a pregnancy. So these muscles are in charge of so much to help us out when we're pregnant. These muscles are supportive, which means they help hold up not only the weight of the baby, but also the bladder, the cervix and the uterus, the rectum. So these muscles have a very important supportive role. These muscles are also sphincteric, and what that means is when these muscles engage, they clamp off the urethra so we don't have any leakage. If we cough or we sneeze or we laugh, these muscles will help make sure that there's nothing that comes out that shouldn't be coming out. These muscles are also really, really important core muscles. So when you engage the pelvic floor muscles and they lift up, they will automatically bring on all the other core muscles in our body. So when the pelvic floor lifts up, you get a really nice recruitment of those lower tummy muscles that help hold up the baby. These muscles also work together with the muscles that hold our hips together as well. So these muscles have a stability role. So they're supportive, they're sphincteric, they're part of the core muscles, that stability role. And these muscles are also really important during pregnancy for blood flow. So these muscles act as the sump pump. And during pregnancy, you have about 3 times the normal blood volume. So these muscles will actually help bring up the blood flow from our legs and bring it back up to our body to help reduce the risk of things like varicose veins in our legs or even pelvic pressure, pelvic congestion that can come from all that extra blood flow kind of sitting in our pelvises. So really, really important that we know how to recruit these muscles and how to use these muscles during a pregnancy. Now, oftentimes we hear of Kegels, and Kegels, the idea being like, oh, okay, we can, squeeze these muscles or tighten these muscles. But for these muscles to work effectively, we need these muscles to be able to lift and lower. So just like, you might go to a gym and pretend you can see a muscle here. If these muscles lift and lower, pelvic floor muscles are the same thing. They need to be able to lift and lower, not just squeeze and tighten. And we have lots of different muscles down here we can use. So we have rectal muscles that can lift up and go down. So you could practice lifting your rectum up and down. We have vaginal muscles, so you can lift the vagina or the vaginal canal up and down. And probably the most important muscles are the urethral muscles, and these little guys are right at the front, and you can lift your urethra up and down. And when we're pregnant, we want to get really, really efficient at recruiting all the parts of the pelvic floor. So if you're just hanging out watching this video, you can practice picking up the rectum and putting it down, or picking up the vagina and putting it down, picking up the urethra and putting it down. And at first we're all like, man, I don't even know where these muscles are. But the more you practice isolating, the more you get them. And usually even in about 3 or 4 days of practicing, you can start to get really good at finding different parts of your pelvic floor. And you might notice when you're lifting up the pelvic floor muscles, you can feel your lower tummy muscles kind of flatten and tighten. And that's a great sign that you're doing it right. So if you go to pick up your pelvic floor muscles, you'll feel that lower abdominal muscle flatten and tighten. Now we have to be careful that we don't work too hard with this. So you don't want to be like bracing or really squeezing hard. It'll happen really organically, really naturally. So if you take a deep breath in and relax, and then you breathe out, and imagine these muscles lifting up inside your body. Sometimes we say it's like lifting an elevator or lifting a zipper up. And these muscles, as they lift up, you're going to feel those muscles kind of tighten around your lower tummy. It's almost like you're giving the baby a hug with these muscles. And that's a great way to start recruiting your pelvic floor muscles.